Our next session is an international leadership panel on how each country and organization is leading the way forward on access, accountability, and action. And I want to introduce the chair of the panel, Professor Dr. Kwame McKenzie. Yay. Dr. McKenzie is the CEO of the Wellesley Institute of Toronto, Canada. All right.
So you're probably wondering where that all came from. So I was explaining to our hosts that yesterday Wellesley Institute ran a small conference, and the last person at the conference was a mentor of mine who's Lord Victor Abadawala from the UK, and he is actually a real baron. He's a lord and a baron. And he said that people come to him and they say, you know, well, how should we speak to you? Should we call you Lord Victor, or should we call you Victor? And he says to them, well, you know, it's fine. You can call me Professor Lord Victor Abadawala, CBE. Yeah, and it's the CBE that makes the difference. So when they said, you know, how we're going to call, they said, call me Kwame. And they're saying, no, I've got to call you Dr. McKenzie. And I said, well, if you're going to do that, you're going to call me Professor Dr. Kwame McKenzie. And they missed the MRC Fellow of the Royal College of Psychiatrists as well. So I feel disrespected. You know, so we have had a wonderful session. The talks have been inspirational. I really love the fact we started with real stories from real people bringing us into the room. And I'd really like to thank, because I am bad at conferences. I'm always doing something else. I don't feel engaged, but I really felt engaged this morning. And I'd like to thank Emily. I'd like to thank William. I'd like to thank Tukai. I'd really like to thank the New Zealand contingent for reminding us how to be relational and human in a conference space. Yeah. And Dr. Kessel, of course, for teaching us about global knowledge transfer. And I loved the fact that she was a TED Talk newbie, but looked like a professional. Yeah, she did a brilliant job. Now, we are always moving forward at a pace. And so I just wanted to do one thing. I wondered if we could just literally take 1 minute, not even a minute, just a few seconds, and just remember what happened this morning. Yeah. Before we start the next panel, just remember what happened this morning. Remember how we felt. Remember all of those things. Remember the spontaneity of this morning, and just remember how special it was. Because it's really easy just to move on and forget and not to take notice of what was, I think, just a fabulous morning. Now, in football stadiums, soccer stadiums, when they do that, at the end, they cheer. Go for it. Now, I've forgotten my microphone, because I'm going to sit down with everybody else. So, you're probably wondering why I've got my... You're probably wondering why... Is this working? Turn it on. Complicated, isn't it? It's really complicated. So you're probably wondering why I'm using my phone. Now, it is actually not because I'm like my teen son who can't be separated from it. It's not that. It's also not because I'm really important and I have to be on it all the time answering emails or seeing whether my stocks are going up and down. It's mainly because I actually got in at 1:30 last night with Steve, Laurie and others, and I'm old enough to need an accessory brain when I get in late at night. But the main reason is this is where I am going to see your questions. So your questions are going to be through the app. I downloaded the app with the help of other people. It does, for me, take a community to help me actually use this stuff. Now, we've got a wonderful session for me, for you. I've been speaking for long enough. We've got powerful women speaking about their leadership in transforming mental health through increasing access, accountability and action. And they are from around the world. We have in the middle Robyn Shearer, who's the Director of General Mental Health and Addictions for the Government of New Zealand. Yeah, great. You're making me happy. We've got Poppy Jaman, who's the CEO of City Mental Health Alliance, based in the UK but working internationally. Okay, guys, keep the energy up. We've got Brenda Restoule, who is the CEO of the First People's Wellness Circle in Canada. And we've got your very own Anita, Everett, who's the Director at the Centre for Mental Health Services at SAMHSA. My next note was I wanted you to interact. But I think that's already happening, isn't it? And I was going to say, if you hear something you love, don't be shy. Yeah, you can clap and you can even cheer, and you're already doing that. You're ahead of me, aren't you? Right? But if you need more information, use the app. That's how we're going to be taking questions, right? So let's start with accessibility, and I'm going to start with you, Robyn, because there's been a huge buzz about what's happening in New Zealand and about the wellness budget and how you're leading the world. But can you tell us a little bit about how that's increasing access to mental health in the widest sense?
Great. Look, it's an absolute pleasure to be here, and we're at the beginning point, I think, of increasing access and choice for people. We have had a recent big budget announcement of a $1.9 billion investment in mental health and wellbeing for New Zealand.
Is that 1.9 billion?
1.9 billion, yeah. And 1.5 of that sits with health, and the rest of it sits across other agencies and other social agencies. The message that we have around improving access and choice for people is to blur the lines, blur the edges between referral pathways and services, make it easy for people to get help where and when they need it. So we are in the process right now of growing new options for people, which might mean when you go to your GP, you're able to get the support you need for your mental health and well-being, not just your GP consultation, but have a peer worker or your practice nurse or another health coach support you with your journey. It might mean going online and getting support. It might mean having a peer worker work with you. When you turn up to ED, there is someone there who can appropriately respond to your needs. So that requires us to have a big investment in workforce, to look at some other innovative solutions such as our e-mental health approaches. And it also requires us to make sure our specialist services are robust. So investment in all of those things has been the approach. There is a big message from the New Zealand government about wellbeing across the nation. So there is investment in schools and school programs, mindfulness, parenting, and that's a really important message as well. This isn't just sitting with health. We are a big part of it, but it's also the ability to grow community response awareness and the newer, I guess, opportunities we have around growing a community response education, people reaching out compassionately to their neighbours and understanding how to do that. So there's lots of really important messaging within that. We do need to grow capacity, capability, understand need, demand, research, all of those things, but connection points, blurring the lines between services becomes a really important message for us.
Okay, so it's a revolution.
It is indeed.
Yeah, and I never actually thought of New Zealand as a revolutionary country.
Oh. Did you not hear us singing this morning?
I'll move on. Poppy, I know when I first heard of you, it was when you were a great advocate for mental health first aid, and I think you ran Mental Health First Aid England or UK. I can never remember who is still part of the UK and who's left.
We're not talking about that. England, Mental Health First Aid England. I set up the social enterprise there.
Yeah, but I know you're now taking a different approach, and you're doing a lot of access to mental health through work. Can you tell us a bit about that?
Yeah, absolutely. So I think where the ambition started is that everyone should be able to talk about their mental health experience without fear of shame, stigma, judgment, and they should be able to access and ask for the support that they need. When you look at our populations, majority of people, a significant number of the population work or have some place that they go to that actually is part of their everyday experience. And so how do we change that so that employers or workplaces are living up to their duty of care? Of course, there's the equalities legislation, etc. So there are legal reasons to be doing this. It's the right thing to do to support people at work. And then we can't get away from the bottom line. If you're actually looking after your people, you're going to actually have more productivity, healthier people that are staying in work. Back in 2016, our government did a piece of work which was led by Paul Farmer, the CEO of Mind, and Lord Stevenson, and it was called Thriving at Work. And there's sort of 4 figures that I want to share with you from that came out. Employers, the cost to employers is 42 billion a year for poor mental health. And more than 50% of that is presenteeism, where people, so as opposed to absenteeism, people are turning up to work and actually not performing, delivering, however you want to look at it. But for me, that is worrying, because what you've got is a lot of people that are at work that are probably also not talking about their mental health issues. So it's a ticking time bomb. You're sitting there, you're turning up, you're showing up. What point does it push over to the other side where you are really unwell? Then you've got the cost of the government is 27 billion in relation to benefits, tax revenue, and NHS. 300,000 people each year walk away from jobs or leave jobs because of their mental health issues, and 15% of those people that are currently at work have got a diagnosis of mental health issues or mental illness but aren't sharing it. So I just think that if you put all of that together and then consider the human cost. So I myself have had diagnosis of mental health issues since I was about 20, and in my early career I tried to kill myself twice. And the number one thing that I always tell everybody that actually helped me and my recovery journey was good work. Because my psychiatrist didn't really get me. My therapist back then didn't really understand the different cultural sensitivities that were required to support me, because services were scarce. There was no literature in my first language or my family's first language that could actually describe what was going on to me. So I had to become sort of almost a translator for my clinicians to understand my cultural perspective, my family to understand the clinical perspective. And I just went, sod it, I just can't do this. I'm going to get a job. And that's what I did. And I know it sounds simple, but it wasn't, because I was also a single parent. So it was the number one thing that helped me, because it gave me meaning and purpose. It brought in an income. And so therefore gave me financial freedom. And it was empowering to get away from this idea of being a service user and actually being a woman that worked and was a parent first. So that's where the driver for workplace mental health comes in. The stats speaks for themselves. And workplaces are a place that actually can then go over and above providing a salary and having someone to, because they can give community, they can give a sense of belonging, and actually open doors to the education around mental health in a non-stigmatized way. So for me, taking mental health out of the health system is the number one way to get to deal with this stigma issue.
There are a couple of things I've heard you say in conversation that I found really interesting about leadership. On the one hand, you've gone into the workplace and then you've been a translator again, and you've translated to allow them to understand the importance of mental health. But then there's also this other thing about who leads and how you get workplaces to lead on mental health. And I was really interested when you look to working with the financial institutions, that it seems like you lead from behind in order to make them transform.
I'm a true believer of servant leadership. So I did a couple of leadership programs through the NHS back in my civil service and my Department of Health days. And I'm forever grateful for those programs, because as a BAME woman, if I hadn't had the opportunity to go on leadership programs that were supported by our government, I don't think I'd be sitting here today. So I think servant leadership and standing behind and empowering people to do the job that they need to be doing better, that's the only way forward, because people like me are expected to stand up and advocate for mental health, because that's what I've done all my career. But when you've got Brian Hayworth, who is the chair of the City Mental Health Alliance, which I can talk about in the next bit, my current organisation, who has a global role within HSBC, standing up and talking about mental health, people look at that and think, that doesn't make sense. And people listen differently. When you've got Michael Cole-Fontaine, who is now retired, the chairman of BNY Mellon, standing up and talking about the fact that he lost his wife to depression and he became a single parent of 2 children, 2 young adults, and the impact that had on his life. You have, people listen differently, and those are the leaders that we need standing on stage talking about mental health. My job is to provide the background information and the confidence for people to do that in a way that they don't feel, I guess, back to this stigma issue, shame.
Yeah, and I think one of the things I love about those stories is it moves from physical access to access in a different way, access through permission, access through psychological access through cultural access, and therefore increases people's uptake of supports that they need. And I just love those stories. Brenda. Now, particular populations have specific needs, and I've been really impressed at the number of Indigenous voices that I've heard so far today, and then also non-Indigenous allies. But there are different ways of improving access, which you've been involved in Canada.
Yes. What we've been doing in Canada is really having conversations with First Nations about what is mental health, and really what we heard from them was, for us, access hasn't been possible for many reasons, and one of those had to do with just the language and the worldview. And so through work in partnership that we did with Thunderbird Partnership Foundation, the Assembly of First Nations, and at the time First Nations Inuit Health Branch of Health Canada, was to begin to ask First Nations to tell us what it was that they understood about mental health. And the very first thing they said was, we don't use that language. In our traditional languages, we don't talk about mental health, we talk about wellness. And so we started to just change language by talking about wellness and mental wellness. And in that conversation, we asked them what mental wellness looked like. And we had a very large conversation across the country with First Nations where they told us what mental wellness looked like. And from that came the development of the First Nations Mental Wellness Continuum Framework. And I just brought that wheel up here so people can see it. And just to give a shout out, there is a booth in the section across the hall where you can take a look at this. But one of the things they told us very loudly and clearly was that the most important part of mental wellness was culture, and that culture must be foundational to all of our work and all of our understanding around mental wellness. And from those conversations, they talked to us about the importance of how culture can support community ownership and development, and just all of the ideas and uniqueness that comes from First Nations in understanding how to address wellness. What they said to us was, culture allows us to put our knowledge and our wisdom as First Nations people forward as the primary step to addressing wellness. And they also told us that we need to start shifting our ideas around what mental health is and moving to a paradigm shift that looks at wellness, that looks at something that's more strengths-based, because a lot of our conversations to date have been around deficits-based. And for First Nations in particular, the conversation has been about how unwell we are with diabetes, how much diabetes we have, how much suicide we have, how much poverty we have, how much we've lost in language, and all of the things we've lost. And what they've said to us is, it is not just what we've lost, but what we've been able to retain, and how we've been able to retain that through our culture, through our knowledge, and through our language. And that when we take a notice of our knowledge and language as being vitally important, we can then begin to look at where that comes from. And they talk to us about things like the importance of supporting families and supporting communities, so that when we are when we are taking an opportunity to invest in families and we invest in communities, that allows our people to achieve wellness. And I think it's interesting because this is the year of Indigenous wellness, revitalizing Indigenous languages. And one of the things that we are finding in the literature now is that the single biggest thing that leads to people's wellness is language. When we have our language, we can be well. And within our communities, that sense of language gives us a sense of who we are. It gives us a sense of our identity, not only as an individual and not only our cultural identity, but a sense of who we are within our family and within our community. And I think it was really interesting, some of the words that Poppy used, because what came out during those dialogues and through research that Thunderbird was involved in at that same time was that they said the main components to wellness for First Nations people is hope, belonging, meaning, and purpose. And when you start hearing that, I challenge you, who does not need hope, belonging, meaning, and purpose in their life to be well? That is something that I think is far more global than what happens in First Nations communities. And I think so what it has done is it has allowed us to have conversations with government at a very different level. It has allowed us to talk about strengths-based ways of looking at wellness, but it has also allowed us to tell government, isn't it important for you to support belonging and meaning and hope and purpose in the lives of everyday Canadians, not just First Nations? And so it's allowing that language to spread outside, where I think for a long time in Canada, First Nations was seen as being, their issues are different and their responses must be different. And in some ways that may be true, but the outcomes are not different. And I think we have to be looking at those kinds of outcomes. And so what I just wanted to mention, I think, finally, I suppose, is that we had conversations with federal departments in the development of the framework, and we brought it to them and we said, here's what First Nations Voice are saying, and we would like to hear from you, how does the work that you're doing contribute to wellness? And it wasn't just with the health departments. We talked to social service departments, we talked to justice, we talked to corrections, we talked to education, employment, and from that we have had an ongoing conversation with them that they've come into what we now have as an implementation team, where we continue to discuss how do we bring this forward. And we have great partners at the table, like Public Health Agency of Canada, Justice Canada, Indigenous Services Canada, and it has allowed us to start looking at how we can make different conversations and use common language that can support First Nations to be at the table at the beginning in determining, designing, and developing programs and services that meet their needs.
Perfect. So, I think it would be really nice if everybody could get a hold of the wheel. I remember I know Carol Hopkins was on the podium earlier on thanking the New Zealand contingent, and I remember sitting in a panel with her that was supporting the Minister of Health in Ontario. And we had some really, really, really academically smart people, all of whom were trying to work out a framework for how we were going to move mental health forward in Ontario, Canada. And we came up with a framework which we thought was perfect. And Carol brought that along and everybody said, yeah, that's better.
Yeah, so there are wheels that you can actually look, and it's tangible that you can go and get from the booth at Thunderbird, but we also have it on our website. It's on the Thunderbird Partnership Foundation website, and it's there for people to see. We have our summary report and our executive report, and we've been doing a lot of work in the last few years, and I think have developed service delivery models. We're talking about how to address sexual abuse. We're talking about some really big issues, and I think what we have heard when we talk to our partners is that it has allowed them to say, this works for us. This is not just a First Nations vision. This is something that works for all of us.
Okay, perfect. Now, you've been busy. You've been really busy. I was looking,
Yes, sir.
one of the things that you do when you're preparing for this is you look at everybody's videos on YouTube, and I was watching you forever. You've been working hard. I was really interested in the work. I say SAMHSA, but because I've got predictive text here, you're called SMASH, according to mine. So I'm just saying that's what this says.
Maybe there's a point there.
I don't know what it means, but I was really interested in some of the work you've been doing with teens. That's one of the things that caught my eye, but I know there are a number of other things that you'd probably want to mention about access.
Yeah, well, thank you. Thank you very much. Yeah, what I want to do is frame my comments around building momentum for a cause. And I really think that's what all of us in this room are doing. I think many of us, and these are all like wonderful examples of what it's like to actually finally be at a point in our field where we have attention. We have the eyes and the ears of politicians and people who make decisions about resource allocations and things like that. And we see that tangibly. And one of my experiences about this meeting being so great is it gives us a chance to sort of get reinforced by seeing what is happening in other places. Our systems are all complex, and I would challenge you to say that any are more complex than our system, which has some federal components, but has state components, and particularly in the mental health system, state components that are different than our health system. Also has local government components. It's a very complex system, and so moving something, getting that momentum and keeping it is a very big challenge. This iteration of access for us started with concerns that were raised actually by our Congress, who set aside a commission, the Interdepartmental Coordinating Committee on Serious Mental Illness. There was some concerns that we hadn't had enough focus on that end of the spectrum of our field. As a part of that, as a component of that, we received public comment. Hundreds and hundreds of pages in small print from people all around the country, and the majority of the abstracts from the comments that we received from the American public all were centered on access. We had teens whose mothers were the ones who wrote in, who talked about access, talked about coming to a system. They couldn't get their son to come in for treatment for a while, charts got closed, and they couldn't get back in. They were told it would take 6 weeks to get back in. Insurance problems. We have, do not have the fortune of having or misfortune, I'm not sure, but a national health system. And so we have a lot of people who have barriers to health care with regards to their insurance status. We have provider shortages, so particularly with regards to who's willing to work with children. We have a lot of these, and sometimes I think it's easier to recite the problems than to sort of get at some of the solutions. But that really brought to the forefront the issue of access, front and center. We tend to think of ourselves as having these different entities that are involved and also different systems well, this is happening, go to a community mental health center. This is happening, go to a private practitioner. This is happening, see if you can get help through your primary care doctor. But we need to think more in terms of the person, what it is that the person who's in crisis needs. And so we, in our role as being sort of conveners at the federal government and thinking about how we can build momentum, keep attention on the need for access as a separate problem, have done a number of different things that look at that. But we've started with sort of framing out, and I think this is just in regards to thinking about leadership, we framed out three things, or three categories of things that we think people in crisis need. And you can think of varying degrees of sophistication of each of these things. But when you think about a person who's in crisis, any form of crisis, a child who's tragically witnessed the death of their mother, other kinds of experiences like we've all seen and thought about, one of three things. So we think the first thing people need is a human being that they can talk with. It can be a close family member, can be a neighbor, can be someone who's had mental health first aid. Even better, you can sort of imagine a whole line of things that have increasing degrees of sophistication on up into trained individuals who are on chat lines or telephone calls. But this concept of someone to talk with, another human being, is very important, and that's sort of the first piece of the framing that we have. Second piece is a place they can go. So what is the place? Is the place a neighbor's house? Is the place a neighbor's house who's had mental health first aid training, or a neighbor who works in the mental health field, a nurse who works in the mental health field? Is the place they can go a crisis center that's increasingly sophisticated in their capacity, their full range of capacity to response? Is it a living room style setting, a drop-in center? Or is it an emergency room? Far too often these stories that we heard from individuals, again, from around our country, were these horror stories of coming to some of our emergency rooms, which are sort of the receiver of last support, basically because of laws in America. The emergency rooms can't deny folks access. But they come and wait days, especially kids, because we have an acute shortage of bed space for individuals. Come and spend hours and hours in an emergency room where they may or may not even receive skilled, specialized treatment. So the notion of a place to go with varying degrees of sophistication is something else that we're sort of thinking about. The third of those, for the few that really can't identify someone to talk with, or in a kind of a situation where they can't talk with individuals, can't go somewhere, are afraid of going somewhere, issues associated with that, is a team to come, a mobile crisis style team. In all communities in the States at this point, it could be a policeman. It could be a policeman equipped with a mental health professional. It could be a policeman equipped with pastors, people from faith-based communities. We have varying degrees of that, but we think that's sort of what we would also like to see. Some of our states increasingly are sort of looking at their crisis response system. One of the ways we describe it is as the front door of systems. But more often, it's kind of easy to think more in terms of places where people go, the state hospitals, the community mental health centers. So I think part of our job at SAMHSA in the federal government, with the role we have, is to sort of look at how we can sort of help communities, help states pull these things together around what it is that the person needs, and how we can sort of take advantage of this notion of building momentum for change. I think all of you are used to that in one way or another, and I think that's a particular leadership skill that we all need to acquire, or already have, and need to share with others who maybe could use that more. So very interested in that. There's a lot of things I could talk on and on about what we're doing literally with that regards to access and the money we're spending to secure better access. But I think I want to just kind of leave it at that it's a challenge for all of us. And this notion of building momentum for change, I'm very excited. I've got 30 or more years in working in public mental health systems, and I'm very excited at the point where we are right now with regards to elected officials, pop stars, and people that are out and about in the world today becoming very open and honest about talking with mental illness. We're in a whole other different level of conversation than we were even 10 years ago. So thanks to all of you for the work that you do to sort of make that, to hold our decision makers accountable for issues like that. So thank you.
Perfect. The last thing you said was really interesting to me, because we've heard about big change that's been made at a governmental level. We've heard about changes that are happening in the sort of delivery, but government delivery systems. We've heard about disruptive initiatives that are happening in the workplace. by charismatic leaders, and we've heard a bit about changing access through changing the culture or fusing culture into mental health. But I'm always worried when we're having big change about making sure that we're reaching the right people and making sure we stay on track. So I'm really interested in accountability and how all of you as leaders and as you've led change have made sure that it's accountable change and how accountability has been hardwired. Who wants to start with that?
I'm happy to start that conversation because it's been weighing on my mind that when we have a big investment, we have to be able to track the money, but more importantly, we have to know that the money's getting to the right people. And there is a balance, I think, with accountability measures and also ensuring that we support innovation and change. And one of the things that we built into our budget was a program to support change and leadership. So part of what we're going to do as we make new investment is to have a change and innovation leadership program where regions are supported with expertise to embed change in our systems. We can't just expect people to take up a new funding opportunity and suddenly collaborate and work together without some support. So the technical support that we provide around our investment will be really important. And at the end of the day, we have to know the money's getting to the right people. So I think it is one of our great challenges, but we have good data and good information. We now need to put it to good use, make it accessible for everybody, and also include those aspects of storytelling where people are saying, this is what works for me, and have a balance between having a range of services that work across our country that are consistent and evidence-based, and then those things that can be individualised and sharing those opportunities and making that known across our communities. So having mechanisms to do that becomes really important. It's not just about what you report, but actually how we promote the things that are working for people and what doesn't work for people, and do something about that. I think through a network, a leadership network like IIMHL, it's a perfect opportunity to be doing some of that storytelling and sharing and accountability structures.
So should I
Yeah,
talk a little
jump
bit about
in.
on the workplace space? So we are, it took a long time to get to a place where workplaces were taking this seriously. And in the early stages, it was very much around, this is a good thing to do. But now we're getting to a stage where actually within the City Mental Health Alliance, which is my organisation, and please do look it up. I won't talk about what we do, but we're a collaboration of big corporates, so employers in the private sector primarily, that employ more than 500 people. We're in the UK, Hong Kong, and about to launch in Australia as well. So one of the number one things that we talk about is making this a boardroom agenda. And we talk about a 3-year journey in terms of making that happen. So first of all, the first step is to socialise mental health into the organisation. If you're an organisation that's never talked about stress, and you're now going to suddenly start talking about mental health, that's a big leap. So you need to socialize and actually create a level of understanding that we've all got a shared understanding. The second piece is around skilling up the organization. And mental health first aid is one of the things that we recommend for line managers to come in. And if you look at Ernst & Young, Unilever, HSBC, they're all rolling out mental health first aid, PwC, Deloitte, etc. And then the third piece is sustaining it, and this is where the metrics come in. So big organizations have staff engagement surveys. Those engagement surveys in the past didn't really ask a well-being question, let alone the words mental health being in there. We've identified a number of questions that you can put into your staff engagement survey. You can look at sickness absence, you can look at presenteeism. So all of that data collection metrics is being developed, and if not already in place for some of these organizations. And what we're doing is bringing our members together so that we pull all of that together and then share it with the world. So the accountability has to come from leadership, I think. And if leaders aren't holding people, if there isn't a big hairy goal at board level, it's not going to happen.
Mm-hmm. And you've got, accountability in SAMHSA. How do you make sure that the services that, essentially at a city or a state level, how do you hardwire accountability in such a complex system?
And that's been a literal challenge for us. Of course, we, as is the case with many of us here, are stewards of the federal tax dollars. So it's part of our job to be accountable on how those things are spent, and also that they make a difference in the lives of those individuals. And so we do require, so one of our common sort of strategies on that is to require individuals who apply for some of our grants to also give us information on how that's done. So it sort of works that way. But even more than that, I want to say that accountability for me, the North Star of accountability for me, there's fiscal accountability, which is of course essential, but the North Star really is accountability to the consumer, the person with lived experience, and how what we're doing is going to resonate in the actual, where the rubber hits the road, so to speak, with the actual recipient of the services, the funding, the government resources that we're allocating. So I've always kept that in mind, and it's been really useful and really not ever steered me wrong that the North Star is the consumer, the recipient, the person with lived experience.
So I warned you all that this would go really quickly. And we are sort of 3 minutes out from taking questions. There are going to be questions. They're in the app already. Okay, I can't. All right, I'll find them. Okay. No, I'll find them. I can do it.
All right, let's check it. You want me to help you?
Yeah. But no, you're all amazing doers. You've all taken action. We've got maybe 30 seconds each. Insights you can share in sort of about leadership and taking action.
I'm happy to start.
I was going to start with Brenda.
Oh,
Okay. I think for us, taking action and leadership is engaging the people who are going to be influenced by the work the most. So for us, it was engaging our communities and making sure that they had their voice heard, and then having their voice reflected in the conversations we were having with leadership, whether it was First Nations leadership or government-based leadership. I think that makes a big difference, that we're asking them to be on the same page, having the same language, and moving towards the same outcomes.
Perfect.
I worked at an organisation called Tapo before I came to the Ministry of Health, and we had an underlying strapline in what we did: where strong relationships exist, anything is possible, and I believe that's what underpins good action. If we have relationships and accountability, then that will help us get a long way.
Okay, we've got a whole bunch of questions, so half a minute.
So for me, I think, every single person in this room, I believe, has got a job and is in the workplace. So the responsibility starts at home with us. So I think we should all be leading on workplace mental health and actually considering how we are supporting ourselves and our teams.
For me, it's a short game, long game. I'm thinking a lot about that these days. Early successes, things that can be done right away and are actionable immediately, and then also not losing sight of the long game, being able to see around the corner what's coming and sort of planning longer, but keeping those two elements in mind at all times are pretty important for evoking any kind of change.
Okay, so we're on time. We're pretty, but you, amazing. It's rare for panels to be on time and to cover such a lot of ground. But I want to get this interaction going, and I do want to start on the questions, if that's okay. And I'm going to be a bit random. I'm going to start with the first person who asked a question. I'm not going to out them because I don't think everybody knew that their name might be up. But where do the panel see the promotion of positive mental health fitting into the response to mental health and well-being? And you can discuss that amongst yourselves rather than... where do you see...
Ask that again, sorry?
Where do the panel see the promotion? Yeah, sometimes when these questions feel like tests, don't they? It's an interview question. Ask that again. I'm going to write it down. Where do the panel see the promotion of positive mental health fitting into the response to mental health and well-being? So we're always, as Brenda was talking, we're always talking about deficits, we're talking about treatment, we're talking about access. But where does positive mental health fit in? Anybody can start with that.
Well, I think it starts at the beginning. So it's the number one factor. So in the all the organisations that I'm working with have to produce a plan, and the one thing that we say to them is start with the 5 ways of well-being. What are you doing? Because that's the hardest thing to implement, costs the least, but has the biggest impact in terms of prevention. Because the intervention stuff, which is, you know, when somebody's sick, most of these organisations know exactly what to do. So I think it's the number one thing, and that's how we've turned the whole thing on its head.
I would have to agree with Poppy. Clap, it's of course. I would agree with Poppy. I think for us, when we've had the conversations about strengths-based, it was the recognition that as First Nations people, we are still present regardless of all of those problems we apparently are bringing forward with us that have come from colonization and so many other things. It's been about recognizing that we have strengths, and those strengths, as I said earlier, have been passed down to us through our language, by our families and our communities. It's in those moments of coming together and being able to show that through our teachings, through our cultural practices, through our community-based practices, and even in our family practices, that we have been able to be resilient, which I think that was shared with us so clearly this morning by William, is that within family we can move together and immobilize strengths to help people to find their way forward.
Yeah, look, my wise colleagues have spoken. Role modelling is, of course, something we need to do as leaders, and I think just building on what's been said, hope, recovery, purpose, we all need that in our lives. It's no different for people with mental health issues or people who are feeling distress or who have addictions. So concur and build on, and we should actually be building this into all of our programs.
Okay, I'm going to ask you something about that, because you talked about sort of developing and leading and being role models. And one of the questions is, for everybody, what are you doing to grow the leadership within the youth and young adult population? I think that's one of those questions that comes, and, you know, we're all experienced here, but the question is, what next?
Well, in the UK, we saw a significant increase in the suicide rates amongst the under 25s. So one of the pieces of work that we've done is we've launched something called Thriving from the Start, which is young professionals that are under 30 coming together in the city still at the moment, and actually creating change amongst themselves through education. Peer support is one of the number one interventions you can provide, peer supporting each other, because actually the other thing is, if you're early in your career, the last thing you want to do is go into work and talk about your mental health issues if you don't trust that the organisation is going to support you and believe that it's going to put your career in jeopardy. So creating a network where we can peer support each other outside is really important, and we've started that piece of work, particularly for the transition from university to early careers.
Okay, I'm going to stop you, because what I'm going to do is something slightly different. We've got lots of questions and we haven't got that much time. So I'm going to read all the questions we've got, and some of those will be questions we'll answer, and some of those will be questions that will stimulate conversation throughout lunch with people. Sorry? It says I've got 4 minutes 51. No? Okay, I'm going to do it anyway. Great to see a diverse panel of female leaders today. Does the panel see a shift in inclusive leadership based on gender and ethnicity happening? So that's one thing. How are individuals experiencing mental health crisis transported in communities? If mental health is enjoying a moment in the sun, our politicians are listening, What is the transformative change we need to make sure mental health or mental wellness is a sustainable, different place when the gaze of politicians moves on? Marlene would ask how you would include language such as American Sign Language and those who are deaf or hard of hearing or late deafened who cannot sign and use primary language. In many different question, in many jurisdictions, police are often the front line for mental health response. Given the gaps in crisis care, police argue this may not be, is not their role or training. There are also problems with the use of force when police are called. What is the best way forward? What can we collectively do to support the new and young leaders, or just young leaders? Also ensure we get greater diversity in leadership, gender, ethnicity, disability. Access for all residents is a question that comes up. Somebody just being really nice to you guys. But
You can read that.
well, I haven't got that much time. It's very long. What would be the benefits and disadvantages of taking mental health out of the health system? How do we overcome the barriers to cross-sectional and cross-community work towards wellness? How do you proceed when government and leadership is working against access, accountability and equity? And if we carry on, we'll be here for a lot longer. And I wanted to give you all the last word. Which of those questions sort of struck a chord with you? And just answer that 30 seconds each.
I'm going to do a general one, and this is about getting our younger community engaged in giving us advice about what needs to happen for the future. We need to be changing the conversation up about a great career pathway in mental health and addiction services, but also not necessarily being here for life, and that recovery hope message is a really important one. And I think for us, young Māori men are on the negative end of statistics in New Zealand, so it's not just about women leaders, it's also about how we grow our men to be the leaders of the future as well. So a shout out to youth and men.
Brenda.
I was just trying to think about what did I want to say in my last 30 seconds. So many really good questions. I think I won't answer the one on youth. We have great youth models that we are working with, but I'm thinking about some of the work that I do in community, and a man that I worked with, or that we work with, how the community saw him as having addictions issues, and that was the problem. But when we started asking him what he needed, he said, I need a job and I need a good place to live. He was living in a condemned home. And so when we started meeting him where he was at without judgment, we gave him work, and if he came to work inebriated, we'd say, today's probably not a great day, let's try again tomorrow. We found that he saved money, he bought things, and then when we started to give him a home, he started coming around, and we saw a change in him physically in terms of being happier, being part of a community, feeling a purpose. He would get stopped in the community and people would say to him, I'm so happy to see you today. I hear you're cutting grass. It's a really great story that I don't have time to tell you in detail, but I think what it showed us was that our leadership said, hey, maybe we're doing this the wrong way. Maybe we need to stop saying we need to give you welfare and we need to make sure you're not drinking. We need to make sure that we meet what your needs are, and then all of a sudden you become a part of community and you become more well. And he now attends things and chooses not to drink on days that are important to him. He's told us, I don't want to ever stop drinking. That's fine. But now he can do things and feels a real sense of pride, community, purpose, meaning, and he has hope. And I think that is what all of this work is about, is helping people realize their potential.
A couple things I resonated with in those questions have to do with equity and disequity. I think for us here in the States, it's really wonderful to see so many different people that are here, indigenous folks, First Nations, things like that, which of course we have here. We have a number of groups that are sort of not at equity, and I think our deaf colleagues, it's very important to have them here because I think we've learned a lot by including groups more overtly, but I think there are groups that are still not overtly a part of the inclusive spirit that we like to think we have, and so there's that. There's rural folks who also have a different set of reasons and ways through which they're disenfranchised, and so I really am hopeful with regards to disruptive innovations or technology that technology might be part of a path forward, particularly for some communities, like rural communities. We do a lot here, or we're growing and learning a lot about access, creating good access to rural communities through that. So I'm very interested in that, very inspired by that as someone, and that will help sort of redirect some of my attention in my leadership role. So I'm thankful for that.
So to the politicians, what if we didn't measure just gross domestic product and measured gross domestic well-being, and there were 3 components of that: respect, compassion, and kindness?
Yeah. Well, that is a fabulous place to end. Thank you very much. I think we're seated here until they bring us off the stage. You will see I got through only a small number of the questions, and the questions are all now coming up on the Twitter wall, and you can see them, and hopefully they will spark conversation and connection going on from this panel. I needed to just really thank our wonderful panelists once more.
And we would like to thank Professor Dr. Kwame, McKenzie, OMG, LOL. Before we break for lunch, though, we have a wonderful presentation lined up for you. I had a chance to meet them a few moments back, but I would like to introduce to you the Wong people lion dance, and they are from the Chinatown district right here in Washington, D.C.
Hey, good afternoon, ladies and gentlemen. We are the Wong People Kung Fu Association out of Washington, D.C., Chinatown, which is a few blocks from here. And we're a group dedicated to the preservation and practice of the ancient art of Kung Fu. And we offer classes for free. So one thing we're going to share with you today is the lion dance. Some people refer to it as the dragon dance, but it's actually the lion dance. So we offer the class for free, and we have people of all walks of life come to take the classes. And we have many people who have not just physical, but mental health situations where they need to improve and manage their situation. So I just want to, let's see, David, John Tell. They've been with me since they were kids, and they use the training to really improve and manage their mental health situation. And they make quantum improvements over the last, I guess, about 10 years, right? Yeah. Okay. All right. Thank you. So that's David Lindsay and John Tell Grimes. Okay. All right. So we're going to share with you today the lion dance. So every culture have their way of obtaining one thing since the beginning of time and still trying to obtain it now. And what is that one thing? I'll tell you. Okay, it's good luck. It's good luck. It's that simple. Because it doesn't matter how much money you have, how much education you have, how good looks you have, how well you're prepared. If you run some bad luck, none of that matters. So the Chinese believe that directing the flow of negative energy, getting rid of some of the negative energy will allow you to have good luck. So we're going to bring in a lion here. We're going to play some music, and we are going to get rid of some of the negative energy, and that's how we start off, usually a convention or a grand opening of a business. So we always start off with the lion dance. So let me get the music here. All right. Thank you very much.
Fabulous. The Wong People Lion Dance, right here in Chinatown, Washington, D.C. Yay! So thank you so much for your performance. And I especially like that it's an example of people who are temporarily troubled. A mental health clinic is not always the total answer, if not the answer at all sometimes. Dance, movement, equine therapy, canoe journeys, connecting back with community, as Brenda was talking about earlier. All of that is what's needed to help people come back into balance. And of course, clinicians are incredibly important as well, but they're not the total answer. So thank you, that was just wonderful. And I don't know about you all, but I am nothing but positive now. So we're going to break for 90 minutes for lunch. On your app, on your phone, you can check out different restaurants and places to go to eat. You can also eat in the hotel here. Hopefully you made a reservation because it might get really crowded. There's many places to eat all around, so look on your app. Also be sure to go by the exhibit room and look at the exhibits. Get your bingo card as was so aptly shown to you. Have people sign each exhibit you go to so you can enter into the drawing. And you need to get your bingo card back into the afternoon draw by 4:45. So if you want to be included to get one of these fabulous umbrellas, which are actually pretty special umbrellas, unique, you'll see. So get your bingo card into the draw by 4:45. And when you come back at 2 o'clock after lunch, we're going immediately into breakout sessions. And all of the rooms are by match topics. And you can look at your app to determine which match you want to hear about and learn about. So enjoy your lunch. And when you come back, go directly into the match room at 2 o'clock that you want to learn about. Have a good lunch.